Sawadee very good evening and welcome to Thai PBS World Tonight. I'm Nabunag.
I'm Tulip นาคสมภพลาว
We'll begin tonight with the latest on the COVID-19 situation, and we all have to admit that the Delta variant is the main variant that has contributed to a lot of new cases that we're seeing every day. The readily transmissible COVID-19 Delta variant, which was first confirmed in Thailand in mid-May in a Thai mother and her 4-year-old son arriving from Pakistan, has now spread through 74 provinces in Thailand, and that accounts for 78% of new infections in the country. The Director General of the Medical Sciences Department, Dr. Supakit Sirilak, said the department and its network of laboratories had conducted random checks on 2,500 COVID-19 infected people around the country between July 24th and the 30th and found that 78% were infected with the Delta variant, 21% were infected with the Alpha variant, and the remaining 0.6% with the Beta strain. However, Dr. Supakit actually said that the Lambda variant, which is a variant of interest as defined by the WHO, is spreading across South America. However, it has not yet been detected in Thailand yet. And now let's have a look at the COVID-19 infections and the figures. Thailand recorded another new high of infections for the second day. The figure has surpassed the 20,000 mark to 20,920 cases today, and that brings the total in the current wave since April to more than 664,000. At the same time, 160 more deaths were also recorded today, bringing the total since April to 5,569. And if we look at the trend throughout this week, we can see that the infections dropped slightly over the weekend before increasing again and surpassed the 20,000 mark yesterday. So it keeps increasing overall, but if we look at the depths, the numbers are quite different. Some were high, some were low, but the record high logged yesterday was at 188.
Yes, and because of the infected rate is very high, it's also come along with the amount of people that have severe symptoms and need to be in the ICU. So Busarakham Field Hospital in Bangkok province just opens another ICU unit to treat severe COVID-19 cases. The Busarakham Field Hospital, which has admitted more than 14,200 COVID-19 patients since its opening in mid-May, opened its first intensive care unit to treat severe cases waiting to be admitted to General Hospital. Assistant Permanent Secretary of Public Health, Dr. Kitisak Aksornwong, said that the opening of the facilities in the car park behind the field hospital at Impact Convention Center, Mueang Thong Thani, will help solve the problem of severe cases in the field hospital who need to be transferred to general hospitals, which are better equipped but are having to wait due to bed shortages. The ICU has 17 beds, 13 of which are for ICU patients and 4 negative pressure rooms, with all the equipment provided by the National Research Institute. Dr. Kitisak said that medical specialists from provincial hospitals will rotate through the field hospital to help ease the workload of the permanent medical staff. Of all the patients admitted to the hospitals in the 82 days since its opening, over 11,000 have recovered and been discharged, leaving 3,333 others now undergoing treatment. And of this, over 3,000, 169 need high-flow oxygen machines, while 450 need standard supplemental oxygen, adding that the number of patients requiring oxygen has dropped. He said that the hospital has adopted a fast-track approach to the admission process by separating frail patients from those who are healthier and conducting blood tests and medication distribution on admission, adding that cleaning of the hospital will be done more frequently. So everybody trying to help, and this field hospital is trying to increase their capacity as well. So usually when we talk about field hospital, it will be placed for mild and asymptomatic, but lately we have been seeing more and more field hospital that adding their ICU units.
Exactly. Apart from the field hospitals that we've been talking about, a number of days we've been talking about home isolation and community isolation as well. And according to the CCSA, around 100,000 people in Bangkok have already entered home isolation, while 20% of the COVID-19 tests conducted in Bangkok with the use of antigen test kits have turned out to be positive. So we can see that the tests, it would turn out to be positive from the use of the rapid antigen test kits. So, home and community isolation programs are designed for infected people who are asymptomatic or have mild symptoms, as hospitals in Bangkok and many parts of the country are experiencing bed shortage. Today, the CCSA assistant spokesperson, Dr. Apisamai Siorangsan, said that 20% of people having undergone the ATK test in Bangkok since July 20th were also found to be infected. People who need to be tested are those whose temperatures are 37.3 degrees Celsius and over, POI patients with respiratory problems, those who are in close contact with confirmed cases, those who have visited high risk places such as markets, communities, and factories, and those whose occupations require contact with a lot of people. She also said that over 100,000 COVID 19 patients in Bangkok have already entered home isolation. And we would also like to mention that due to the increasing of numbers of the new infections. Dr. Episamai also mentioned that there are 8 new clusters across 5 provinces that have been found. So that includes Samut Prakan, Chonburi, Samut Sakhon, Ayutthaya, and Phuket. And that wraps up tonight's edition of Thai PBS World Tonight. Don't forget to catch the latest news through our website, thaipbsworld.com, as well as on our social media accounts. We have Facebook, Twitter, YouTube, Instagram, and TikTok. Thanks for watching. Stay safe, and we'll still see you tomorrow. สวัสดีค่ะ
สวัสดีค่ะ